Hi, and good evening. My name is Maureen May. I'm the president of PASNAP. I'm also a registered nurse and have worked at the bedside for 36 years, and most recently at Temple University Hospital, which was hit hard by the COVID-19 crisis. We as frontline healthcare workers were thrust into this pandemic crisis without proper PPE, with less than adequate staff, and we experienced fear and frustration as well as mental and exhaustion and physical exhaustion. We were rapidly looking at policies and changes to policies and feeling that frustration every day that we went to work. And we also felt it when we were home. Although the fear and the frustration and the exhaustion are not as palpable as we approached the peak of the curve, we still have fear and frustration. They still persist, just like this virus. And if you're anything like me, you are asking yourself, will any of these feelings ever abate? Will they resolve? Will they be there all the time? And the bigger question is, will it ever be safe for a frontline healthcare provider as myself to go into the healthcare professional or world and to be able to go to work and feel safe? I don't know if we feel safe now. We feel safer than we did, as we, again, were still in the crisis. We don't feel like we're in crisis mode now, only because we are not at the peak of the curve and we know a little bit more of the unknown. But that's what this webinar is all about. And PASNAP was lucky and has asked nationally recognized experts in disaster and mental health to provide resources and evidence-based practices for the handling of this strain that we have felt and so many of us have experienced. So the question is, if we don't start caring for ourselves, how can we keep caring for others, our family, our patients? And I've often heard that it's, you can't give away what you don't have. If you don't have money, you can't give money away. If you don't have emotional support and you don't have the physical and mental capacity to do what you need to do in a crisis, we're still there in the crisis. So how do we figure that out, and how do we give that away if we really don't have it to give away? So our experts today are the professor of Dr. James Halpern, Emeritus Professor of Psychology and Counseling and founding director of the Institute for Disaster Mental Health at the State University of New York at New Paltz, and Dr. Amy Nitza, who is the Institute's current director. They each have worked extensively with survivors of public health emergencies such as the September 11th attacks, the Sandy Hook school shooting, the hurricanes of Katrina, Maria, and Harvey, among many others. And they created this webinar specifically for our PASNAP members, with our PASNAP members in mind, and with the pandemic in mind. I'd like to welcome them and thank them on our behalf for all of us. But before I let them take it away, I'd also like to invite you to participate in a COVID-19 CHAMP study. And this study is being done at Villanova University through the Louise Fitzpatrick College of Nursing. And it's to look at the impact of COVID-19 and to understand the immediate and long-term effects, both emotionally and physically, for us that are caring for COVID patients, and how it impacts the lives and our careers of all frontline healthcare workers. I just want to say that I have personally joined in the study. I look forward to reading the study. There's a lot to be gained by participating, and you can find more about that on the website at PASNAP, or you can go directly onto the website at villanova.edu champs, CHAMPS. I'm very excited that they're doing this study, and I have encouraged many of my colleagues. It's a very short survey to start out with, and we'll learn about more of what we have experienced during this pandemic and what those studies show. It's for all frontline healthcare workers, whether you are paramedic, anybody. It's not just nurses, it's physicians, it's respiratory, it's all frontline healthcare providers should participate in this, so we can gather the evidence to determine how this impacted us during the course of our career. So anyway, I hope that many members will take part in that study to advance our understanding of what has happened to us, which brings me back to Dr. Halpern and Dr. Nitza. Welcome. PASNAP is thrilled to have you as part of this evening with us, so thank you.
Okay. Thank you so much, Maureen, for that introduction. And a thank you to Barbara Nectow, Megan Gorman, and many others for helping to arrange this presentation tonight. And thank you all for being here and taking a little bit of time out from your very busy, very hectic days to look into some of these mental health related issues. So very briefly, our agenda for tonight is to look at just a few of these issues, the nature of the stress that you're dealing with, how you can best cope with some of these challenges, looking at some of the resources that are immediately available to you, and then how to recognize some of the signs and symptoms of extreme stress to look and see if you may or may not need some professional counseling or support. As we go through the presentation, you'll see that there are some slides with checklists and links. So if we go by them too quickly, you can certainly go back to the recording and take your time to gather those links. As we look at these stressors and challenges, which is where we begin here because we've got to acknowledge that there's a problem. There are some in our culture who seem to want to refuse to see that there is a problem, but if we engage in denial or refuse to see the issues, there's no way that we're going to solve it. So that's where we start with some of these stressors and challenges. Um, you know, this is probably second to the 1918 flu, the biggest, the baddest, and the longest disaster in American history. COVID-19 is going to impact and kill and last longer than any other event other than the Spanish flu. Um, New York Governor Cuomo has made reference to cabin fever, which is this discomfort from being isolated and alone in our homes or getting bored. Quite frankly, some of the mental health impact is going to be much more difficult than that, is already much more difficult than that. And one of the reasons for that is that it's not just deadly, but it's deadly creepy. We can't see it. We don't know if perhaps we're infecting others, if others are infecting us. There are so many concerns. But it's important to note that when we're in the middle of an event, it's difficult to take notice of the mental health issues, but it's important that we don't underestimate those mental health issues. In this slide, what we see is some of the results of some already current research about what the nature of the current stressors are that are impacting so many mental health care providers. That is, the situation is changing so rapidly. And Maureen spoke to all of these. I'm sure you're very familiar with this, but again, the research seems to corroborate what so many of you are going through. People are being asked to change roles, taking on unfamiliar duties, having difficulty with inadequate resources, inadequate PPEs. The last three items speak to, and actually so do so many of the others, what is pretty new about this event and what is pretty new in the US, and that's what's referred to in the literature as a shared trauma reality. A shared trauma reality means that the helper is experiencing some of the same problems as the client, as the patient. And so you may have patients or clients who are worried that they've infected their family, and that could be impacting you as well. You're worried about your family, your patients are worried about impacting their families. I have to say this, and around the world in some very difficult war zones, there are helpers and doctors who are diving for cover when there's a missile siren along with their patients. And that's the kind of shared trauma reality that we see with COVID-19 that we don't see so much in the United States. So what are some of the workers saying? And again, this is some of the research and as well as some of the anecdotal material. So many patients working outside my usual role, worried about my kids, worried about my family, my partner, feeling isolated. And these last two items I want to just spend a minute with. And that is that one of the great tragedies of COVID-19 is that it denies patients and families the opportunity for healing and spiritual preparation. So most healthcare workers are quite trained and experienced in working with death and dying. But with COVID-19, many healthcare workers are experiencing an awful lot of bad deaths, which can certainly take a toll. And then just I have to say, to add insult to injury, there are many in the healthcare profession who are worried about their own finances, worried about the possibility of layoffs, worried about losing income, worried about losing health insurance. So again, these are some of the issues that come up. Let's go back one. Yes, there we are. And just another stressor, again, that makes an already very difficult situation just that much more difficult. These kinds of events create so much misinformation and rumors. And when the events are ambiguous, it's much more likely that rumors will be spread about. Um, we're also not thinking as clearly as we might if we're under extreme stress, and we therefore can pass on misinformation. So we need to be very careful about that. There's a few examples at the end of the slide about some of the kind of rumors that can occur and have occurred throughout Pennsylvania, and we know how quickly that can happen, especially with social media. But just one more point here. And that is that George Bernard Shaw once said that the biggest problem with communication is the illusion that it's taken place. And so let's keep in mind that when we have accurate information, and we want to be sure that we're passing on accurate information, that we take our time and that we make sure that we're heard. Because again, in these conditions, we want to be sure that the accurate information is passed on effectively. Here we see some of the results of the research that was done in the 2000s as a result of the SARS outbreak in Canada. And again, the research from that SARS outbreak, I think, is revealing as it relates to what may be the principal concerns for current healthcare workers. And that is primarily that conflict between being responsible to ourselves and our families on the one hand, and our professional responsibility to our colleagues, to our profession, to our patients, and so forth. What they also noted was an extreme stressor was that level of uncertainty with infection control procedures, policies, modified daily and sometimes hourly, created so much anxiety and difficulty. And what they also said during the SARS outbreak was that people weren't getting enough rest. And in fact, were worried that they may not be doing as the kind of job that they wanted to do because they were so sleep deprived. Here we see that the good news, and Amy's going to be speaking about this momentarily on effective coping, is that most healthcare workers, most nurses, did find their own individual coping mechanisms. They found ways to deal with this, but there were some generalities, and those generalities had to do with workers benefiting from shared concern, good information, good social support, whether it was informational support or emotional support. And it was very important to almost all of them that they not feel alone, that they not feel isolated. So one of the findings, in fact, and you guys all know this way better than me, there was a lot of discussion of the sharing of dark humor at the nursing station. And some of the things that they said I'm not able to repeat tonight, but it was just one of the ways that people were coping.
Okay, so like James said, I think the good news here is that there are some things that you all can do. Oh, I think, can you go back one? There should be one in between there, the smoke tower and the watch detector. There we go. There are some things that we can do to build resilience to, you know, as I think that a summary of some of the things James pointed out is that the chronic nature of this wears people down over time. This is much different than an acute an acute disaster that happens once and then goes away and leaves people to cope afterwards. And so we really wanted to frame tonight in terms of building and sustaining your resilience in coping with this ongoing stressor. So we just wanted to sort of briefly explain how this works in the brain, because the resilience strategies that I'm going to talk to you about are connected to this idea of resilience being about brain balance. And so that's what I'm going to talk to you about. So there's a metaphor about how all this works in our brains from Bessel van der Kolk, who's one of the leaders in our field in terms of psychiatry and trauma. And he talks about the brain being, part of the brain being a smoke alarm and part of the brain being a watchtower. So the way that this is designed in our brain, so when our brain detects a threat, the emotional part of our brain turns, I'm sorry, can you just go back? I didn't mean to, I'm talking with my hands. I didn't mean to be signaling you to change the slide. I just talk with my hands. The emotional part of the brain is like the smoke alarm in our brain. And so when its job is to monitor for threats and then alert us by turning on that alarm when there's a threat. And so it monitors the environment. When it notices a threat, it flips a switch and the alarm starts going off in our brains. Then the rational part of our brain, which is the prefrontal cortex or the neocortex, its job is to sort of be a watchtower. So it notices the threat from the smoke alarm, and then it scans the environment to decide if the threat is real or if it's a false alarm. And if the threat is real, it makes a plan of action to escape the threat. So if the threat is that there really is a fire in the house, the smoke alarm is going off because there's really a fire in the house. The rational part of the brain will say, okay, we need to get the kids, get out of the house, call 911. We take that action. And then slowly the emotional brain will go back to, the alarm will turn off and it will go back to its monitoring function. That's how we're designed to work. So, or if the threat is not real, it will say, oops, that was a mistake. It was just, we left the pot roast in the oven too long and there's smoke in the house. So we need to get the pot roast out of the oven. We need to clear, open the windows, turn on a fan, and then we'll be fine. And again, once that happens, the smoke alarm can shut off and go back to monitoring for the next threat. Okay, so that's just a metaphor to talk about how our brains monitor for threats like extreme stressors, and then manage that. Okay. So in daily life, managing stress relies on that balance between those two parts of the brain. So in daily life, those two things work together pretty well to help us decide when we're in danger and when we're not. With traumatic stress or extreme stress, like the stress a lot of you all have been under lately, it's almost as if the smoke alarm can get stuck in the on position. And that is, if you imagine or remember when the smoke alarm in your house is going off, it's really overwhelming, right? You can't really do anything else. It's not like you can sit and enjoy a cup of tea and read a magazine while that smoke alarm is going off in your house. It's very distracting. And it's the same thing in our brain. When the smoke alarm gets stuck in the on position, when we're stuck in that fight or flight place, all of our brain's attention gets focused on trying to shut the smoke alarm off. So at the expense of other brain functions. And those other brain functions are things that we need to navigate through our day, like make decisions, planning, memory, concentration. Those brain functions can get sort of hijacked by the smoke alarm in our brain getting stuck in the on position. And so for purposes of today, I want to define resilience as how quickly our brains can get back into balance when it gets thrown off, when the smoke alarm gets stuck in that on position and the brain gets out of balance. Okay, so if we think about the brain being in balance and the emotional and the rational part of the brain working together nicely, that's like the green zone. And then when the smoke alarm is stuck in the on position and we're in that fight or fight place, that's like the red zone. And so resilience is how quickly can we, or are we able to bounce back to the green zone after we've had a red zone experience? Okay. And so you can go to the next one. If that's the definition of resilience, how are we going to do that? And the good news here is that there are lots of different pathways to the same goal. And so, you know, we do a lot of training with people who are comfortable, who aren't comfortable with things that deal with emotions, and who prefer to be in a cognitive, rational place. And that's great, because what I'm trying to show in this graphic is the sort of intricate connection between our thoughts and our emotions and our behaviors. And so they all impact and are impacted by each other. So you can start in any of these places and have a positive impact on the other places. So when we train first responders, let's say, they typically get a little resistant if we start talking about emotion-based strategies like mindfulness or meditation, but they're super comfortable in a place of interventions that rely on thoughts and cognitions. Other people are really comfortable in a behavioral place, right? So those are things like, I don't have a slide about those tonight, but those are things like exercising, getting enough sleep, working from a behavioral place to then impact your thoughts and the emotions. So again, you can pick any of these places and start there, and they'll have an impact on the others. So I combined emotions and behaviors for purposes of today. So emotion-based strategies are things like mindfulness practices, meditation, any sort of deep breathing or relaxation strategy. Yoga kind of combines both the emotion-based and behavior-based strategies. It's got some of the emotion regulation, breathing pieces, but it also has the physical exercise. There's also physical exercise and anything in that category that works for you. There's actually some really good research that even 2 or 3 minutes a day of a mindfulness practice will slowly have an impact over time. And what I want you to hear about that is that if you do any of these things once, it will create a good experience. But it's doing it over time, doing it daily, that really sort of strengthens that muscle in the brain to allow it to get back into balance more quickly after a stressful experience. And so these things help with the regulation and the balance. And when you do them over time, it's much more likely that the brain is going to know what to do after a stressful experience. And then, but for people who aren't into those strategies very much, there are also cognition-based strategies or cognitive-based strategies. And these are strategies that work from the place of addressing our thoughts. And our thoughts impact how we feel. What we tell ourselves or our self-talk really influences how we feel. And so when anything happens to us, we have an immediate emotional reaction. But then that emotional reaction is quickly followed by a lot of self-talk, right? A lot of things like, I can't believe this is happening again, or this is so awful, or I can't believe I screwed this up, or any sort of chatter that goes on in our head. And that actually that negative self-talk can sustain that emotional reaction. So it can sort of be fuel for the negative emotions. And so getting a handle on our self-talk and starting to rework our self-talk, that's what I mean by cognitive restructuring, is listening to the self-talk in your head and seeing if it's super negative, and then thinking about how you can start to replace those negative thoughts with something that's a little more neutral or something that's a little bit more realistic. I don't mean, this isn't a just think positively all the time talk, but a lot of times the negative self-talk we have isn't super realistic. And one more thing about this, I read in a book recently that our brains are, I really like this metaphor, our brains are like Velcro for bad experiences and Teflon for good experiences. So the bad sticks and the good tends to slip away. And from an evolutionary perspective, that probably made some sense, but it's not super helpful to us right now. And then the third cognitive-based strategy that I'm going to talk you through is called stress inoculation. You can go ahead to the next slide, please. Oh, and one more. Okay, so stress inoculation is just like, I guess I'm talking to healthcare professionals, so I don't have to explain this, but it's the it's a similar to a vaccine or an inoculation against the flu, right? The goal is not of an inoculation is not to avoid exposure. Getting the flu shot isn't going to change your, isn't going to prevent you from being exposed to the virus, but it's going to help your body mitigate the impact once you are exposed. And stress inoculation is the same thing. It's not that you're not going to be exposed to stress. Clearly, in the current situation, you all are exposed to extreme amounts of stress from a lot of different directions. But it's about a preparation process to help mitigate it when it is impacting you, and preparing in advance so that when the really extreme things happen, you already have a plan. And making a plan before something happens is always better than trying to make a plan in a crisis, because in a crisis, our brains are out of balance and we're not thinking properly. So there are some steps to this. But I think what I'm going to ask you to do actually is go to the slide that's called the flow chart. It's slide number 25. I think I'm just going to use slide 25 to do the whole thing. There we go. That's going. Thank you. So the first step in this process is identifying what specifically about the situation is causing you stress. So this is a lot. This is like a big cloud of a whole bunch of stressful things that kind of can start swirling together and just feel like one big overwhelming blob, I don't know, of stress. And that's not something we can do something about, but can you write down and identify concretely and in as small a chunks as possible, what specifically are the things that are stressing you out? Okay, that's step one. Not just COVID-19 is stressing me out, but what specifically is it about COVID-19 that's causing you stress? And then for each of those stressors, give it some thought and see, are you perceiving this threat? I'm sorry, are you perceiving this stressor as a threat, or are you perceiving it as a challenge? And the reason that's important is because if you see something as a threat, that's when we get into that fight or flight type place. That's why I have it in red. That's like a red zone experience. So, and when we're in that red zone, we do not have all of the resources about us. All of our internal resources are not able to be marshaled to the cause. But if we see something as a challenge, that's more of a green zone type of approach, a balanced brain type of approach to handling a situation. And then we have more access to our internal resources because our brains are functioning sort of at full capacity, right? And so if you're perceiving those as a threat, what can you do to reframe it? To try to think of it more as a challenge so that you're attacking it from a green zone place instead of a red zone place. So can you use some self-talk strategies to change some of your self-talk so that it's a little, I said positive self-talk, but maybe less negative self-talk or more realistic self-talk? And then remember your strengths. So this is about thinking about how you've gotten through hard times before, or honoring the fact that you have gotten through this crazy chaos of COVID-19 so far, specific skills that you have. And then support. One of the things that we know from research that James and I talk a lot about is that the best predictor of how well people are going to do after a trauma or a disaster is their level of perceived social support. So the more social support you have, or that you feel that you have, the more likely you are to have a positive outcome. And so reaching out and connecting to people around you. So those are strategies to try to shift from that red zone of the situation or the stressor being a threat to switching it to a green zone experience and trying to perceive it as a challenge that you can then harness your resources to fight, okay? And then the next step, and these are all important, but I think this next one is particularly important, is are those stressors that you've identified things that you can change or control the outcome of, or are they not? Super important, because fighting over and over to try to change something or control something that you actually objectively don't have control over is a recipe for learned helplessness. That's like metaphorically just beating your head against a wall. And learned helplessness is related to depression and a bunch of other negative outcomes. And James is going to talk to you more about those in just a minute. Okay. So of your list now, the stressors you originally planned out, put the ones you can control in one category and the ones you can't control in another category. For the ones that you can control, now you can use some problem-focused strategies to make a plan for how you're going to change or control those. So breaking it down into manageable parts, using a set of problem-solving steps. Those are easily Googleable. They're all things that are obvious, but sometimes we forget them. What are the steps you need to work through to solve a problem? Using brainstorming to generate as many ideas as you can about how to solve the problem. Or skill development. Maybe you need to learn a new specific skill in order to cope with this specific aspect of the problem. Okay? If you cannot control the situation, if you cannot control the outcome, what you always have control over is your internal experience, your internal reaction to that experience. So this is a different set of skills. This is emotion-focused skills for coping with your reaction when you can't cope with the external experience. So now we're back to strategies like relaxation. I would put mindfulness and meditation in here. Anger management skills, any other skills for tolerating distress. And even I would include distraction in there. Distraction is not a great long-term strategy. In fact, it's a bad long-term strategy. But in a moment, when you're feeling a particular wave of something really uncomfortable, what do you need to do to get through that moment? And in our office, we make a lot of jokes about cat videos. I'm not recommending cat videos per se, but what is it that you can do to just distract yourself in the moment when that's all you have? And again, that's for things that you don't control. You can't control the outcome, but you're just trying to manage your internal reaction to that experience. Okay? So that's stress inoculation really quickly. And if you want more information about that, or I'm happy to share that with you, and you'll have these slides. But just to review, so step one is writing down your stressors and breaking the overall situation down into as smaller parts as you can. Then for each of those components, think about how you're perceiving it, threat or challenge, with the goal being to perceive them as challenges instead of threats, so that your brain is approaching it from that green zone balanced place, and you're able to harness the resources that you have available to you. And then taking another look at the list and saying, are these things I can control and change the outcome of, or are they not? And you're going to separate those out. And then for the things that you're going to control or change, you're going to make a plan for controlling or changing those. For the pieces that you can't, you're going to make a plan and practice some skills for coping with those things. And that is stress inoculation. And I just want to say one more time that whichever of these things you do, try to pick one that works for you, right? An emotion-focused strategy or a cognitive-focused strategy. Choose one that you're likely to keep doing, and then try to make a daily practice of it to strengthen that muscle and make it more likely that you're going to be able to use that strategy in the moment when you need it, and also to make it more likely that your brain is going to more quickly return to that green zone place of balance, which is our definition of resilience. And with that, I'm going to turn it back over to James.
Okay. Well, Amy gave a very cogent presentation on how you can manage your own stress and take care of yourselves. What we're about in these last, 10 minutes or so is really about where to find some resources that may assist you with care for minor problems or more significant problems. So we see here, there's a whole host of websites that you can find for meditation, deep breathing, and here's just a few of them. And they are some that we've looked carefully at, so they're good ones. We also find that there are tip sheets that are available through the Institute for Disaster Mental Health that are very useful in terms of coping with stress and helping others to cope with stress, helping little ones to cope with stress. But I also want to note too that there are websites available, that Disaster Interfaith Network, if you're looking for some spiritual support. And I would say this, there are plenty of folks who are struggling with mental health issues and spiritual religious issues at the same time. And so they don't conflict, they're not in opposition in any way from one another. And so if you're looking for religious or spiritual support, be sure that if you're connected to a house of worship, to contact your spiritual support provider. And then finally, that last link is the National Association of School Psychologists. And there's wonderful information there if you have kids and you're thinking about how to best speak to them, or you're worried about some of the anxieties that they might have. And it's in multiple languages, and a very good website that I highly recommend if you've got issues on working with kids or issues connected to your own kids. In the next slide, we see that if you're interested in crisis counseling, there are a lot of trained mental health professionals who are available to speak with you whenever you feel that need. And again, this may not be something that most of you need, but certainly there could be a time that it would be nice to speak to somebody who was a licensed mental health provider, clinical psychologist, a social worker, a mental health counselor, who are all likely to be on the other ends of these lines. And they would, more than anything, listen and help you sort out some of the complex, confusing thoughts, feelings, that massive confusion that Amy was referring to with her hands and what's going on in the brain. So a lot of times feedback and listening with these folks can be extremely helpful, but they can also give you assistance with some problem solving. They can provide referrals and resources. And I would recommend, you see the second bullet point down, the Disaster Distress Helpline. That's a national 24/7 hotline. Those folks have been doing this for a very long time. It's available in many languages. And certainly, again, if you're struggling and you just feel as though you want to reach out to a licensed mental health person for crisis counseling, you could give it a try. But crisis counseling may not be all that everybody needs. I would suspect that your training, your experience, your commitment, dedication to your profession, to your colleagues, to your patients is very mitigating in terms of the kind of problems or issues that you're dealing with. But if the stress is big enough, anybody can really struggle and have symptoms that would mean that they might be better off seeking some professional counseling, particularly if symptoms are not dissipating over time. So if you have a colleague who you see is really struggling, it might be okay to recommend or suggest that they seek some professional help. Depression is sometimes caused by extreme stress. And here you see a number of the signs and symptoms of depression, which has to do with just very depressed mood most of the day, most days, weight loss, weight gain, not sleeping, not being able to get out of bed, fatigue, loss of energy, feeling just terrible about oneself, not be able to think clearly. If you have these symptoms, or a number of these symptoms, or think that you might, certainly the idea of consulting a professional might be useful. And as I said before, this may not apply to most of you, but it certainly could apply to a significant minority of you who have had some particularly difficult experiences. And if you've got a colleague with these kinds of symptoms or signs, then it would also be helpful to suggest that they get some support. I have to say, a lot of folks with these symptoms don't seek help, and healthcare professionals are sometimes notorious for seeing themselves as helpers and not seeking help. You may have some sense of that, but again, we all can benefit from help some of the time. And here you see in this next slide some symptoms of extreme stress. That is, if you're being invaded with thoughts that just that you don't seem to have control over, or if you're avoiding people or places. And by the way, one of the most common ways that people avoid reminders of awful experiences is drinking too much. Or if you're feeling just terrible about yourselves or other people and the world. And again, that alteration in arousal and reactivity means you're not sleeping. I mean, if you're not sleeping, that's going to put you at risk for not doing well for yourself and not doing well for the people around you. So there again, if you're experiencing these kinds of signs and symptoms, good idea to look for some support and look for some kind of help. A checklist. This is very well researched, very evidence-based. Chris Brewen and his colleagues developed this 10-item list, and I'm leaving it here for a couple of seconds. If you're answering yes to 4 or 5 of these questions, it's probably a good indication that you could use some professional support. And if you're answering yes to 6 or more of these questions, I would say that it's very likely that you could benefit from professional support. So if you don't have time to go through this right now, you can come back to this list a little bit later on just to see if this checklist applies to problems that you're having or problems that a colleague is having, and then you could benefit from counseling. And we see in the next slide that, as I said before, most of us in the helping professions are not real good at taking care of ourselves. I have to say, I've probably been to so many self-care webinars and videos and have read so much, but we're not good at it. And it's difficult for us to accept limits. We feel as though we have to treat others. And if we're taking care of ourselves, there's that distorted, as Amy noted, distorted and unhelpful view of oneself as selfish or needy. It is true that many others are suffering worse, but that doesn't mean that we shouldn't be taking care of ourselves. And again, even stigmas about feeling that we're weak if we seek help or that we're not able to handle the job and so forth. These are all reasons why people can avoid looking for some professional counseling when in fact they could be benefiting greatly from that professional counseling. And here, what you're seeing are the evidence-based gold standard counseling approaches working with extreme stress. So again, the idea that there are these randomized control studies of these approaches to working with stress, so that if you're recommending counseling to a colleague, you can feel pretty confident that the help they get is going to be helpful. If you yourself are struggling with extreme stress, the research is pretty clear that these approaches these trauma-informed approaches are going to be helpful. But I should also note that your relationship to the counselor, and that I speak to those of you who've never been in counseling or therapy or anything like that, you might not hit it off with the first person that you speak with, because having that kind of rapport, having that kind of connection is really very important if you're going to go see somebody. And so, of course, getting a good referral, getting a recommendation from somebody that you trust, that's key. But also your own experience with a counselor is also important. And I would say this, if you meet with a counselor because you're struggling, suffering, having a really hard time, and you don't quite hit it off, you really could go see someone else. I mean, again, all of you in the healthcare profession are aware of the fact that we sometimes do get second opinions. So you could see somebody else. And again, for some of you, and for some of you have colleagues, it may be important to get that kind of help so that you can continue to serve yourself, your family, and the folks around you. Finally, I have to say that there are so many Americans who have you in their thoughts, in their hearts, in their prayers. And it's very important, I think, that you really be able to take that in and appreciate that even though you might not want to be hugged right now, there are a whole lot of people who really would love to if they could. Yeah, you really might not want that, but there are a whole lot of folks who really would want to be able to do that. And I also want to say that there are many of us who are advocating very strongly to our elected officials that you get the compensation, that you get the health care. So more than just warmth and hugs. We want to be sure that you get the compensation and the health care that you deserve. And many of us are advocating for that because we are very grateful. And as Pasternak writes, you must never under any circumstances despair, to hope, to act. These are our duties in misfortune. And the next slide has our references, I think. Yes. Thank you.
Okay, well, thank you very much. That was very informative. I enjoyed the inoculation, stress inoculation. I've never heard of that before. We inoculate our members as we are getting into union campaigns, and we inoculate our patients, but I've never heard about stress inoculation. I really enjoyed this video and webinar, and most importantly, that we've had the experts have the time to speak with us and prepare this webinar, and we will be able to put it on our website, and we will have your slides available as well. We also would like to, if anybody has any questions, I know there has been an email that went out about questions. We can have questions come to us, and we will look at the questions later on. We didn't have a Q&A for this webinar, but we are open to questions. I want to thank you very much for all of your expert help here, and that is what it is, help for the caregivers, and I have learned much from this. So thank you, thrilled to have you, and we appreciate all that you do.
Thank you so much.
Thank you. Thanks for all you all are doing.
Good night.
Good night.